Hi, thanks for joining me today on The Present Mind here on MCTV. Today we are going to be talking about persons with special needs and accessing medical and dental care in accordance with those needs. Persons with special needs have different requirements from those of us who are so-called normally abled. And we're going to discuss some of the challenges that they face and how we can overcome those challenges. Additionally, later we will be joined by Dr. Rama Balkaran, who is a lecturer at the University of the West Indies School of Dentistry, and she will be speaking about dental care for persons with special needs. As we're all aware, in our society, there are many people who are differently abled or who have special challenges that they are coping with. I don't think that we have any reliable figures for Trinidad and Tobago, but in 2016 in the United Kingdom, there were approximately 13.3 million disabled persons, and of these, about 7% were children. Now, persons who have special needs, their needs and their limitations could be expressed in many ways. For instance, they could have physical limitations, such as problems with vision or hearing, or they may be amputees, which may lead to mobility issues. They may have developmental problems such as autism or cerebral palsy. They may have medical issues such as bleeding disorders, or they may have cognitive impairments such as anxiety or schizophrenia. And persons who are dealing with these issues, they have different problems that they are going to face in seeking medical care. For instance, they often have issues with finances, because they often cannot work, and when they do have money, they have to spend it on medications or other treatments for their illnesses. They may have communication problems, as in the cases of persons who have problems with speech, or they may have problems understanding what is being said to them. They may have problems with transportation. They may need to have special vehicles to take them from place to place, or if the public transport service is not conducive to persons traveling with crutches or wheelchairs, that may pose additional problems. Some other barriers to care include inability to understand due to low levels of cognitive functioning or intellectual ability, if their family members are not well educated, and if the staff that is looking after them is untrained or unfamiliar with looking after persons with special needs or their unique requirements that they may have. But there are ways to overcome these barriers, and first and foremost is education. And education is at all levels. We must educate our professionals to be able to understand the challenges that these persons face. We must educate the person about why they need proper health care or dental care and how to access this and why it's important to keep their appointments. And it's also at the level of the family. The family must be able to understand why it's important to take the person to the doctor or to the dentist, to do the treatments as prescribed, to keep up with the medications even if there are minor side effects, and to be able to talk to the doctor about the problems that they're facing. Additionally, things such as toothbrushes can be modified for persons who may have problems grasping, if they have hand issues, so that this would allow them to hold the toothbrush better and allow them to brush their teeth more easily. We should always be aware of the medications that persons are on and the side effects that these medications may give. For example, weight gain or dry mouth. And finally, we should remember that when persons are on more than one medication, these medications can interact and cause negative side effects or problems. So it's important to know what the medications the person are on and to discuss this with the professionals at each visit to ensure that the medications are not working against each other. So these are some of the issues that face persons who have challenges or special needs. And when we come back from the break, we will be speaking with Dr. Rama Balkaran, who is a dentist specializing in special needs dentistry, about how they work with clients with special needs and what we can do to facilitate this. So please stay tuned to The Present Mind here on MCTV. We'll be right back. Welcome back to The Present Mind. Today we're talking about medical and dental care for persons with special needs. I'm very privileged and honored to have as my guest today Dr. Rama Balkaran, who is a lecturer at the University of the West Indies School of Dentistry and who actually heads the Special Needs Dentistry Clinic. Dr. Balkaran is a PhD candidate. She has worked both in the public sector in Trinidad and she also has a private practice. So she's familiar with all of the aspects of dentistry in Trinidad and Tobago, and she has international experience as well. So Dr. Balkaran, thank you very, very much for joining us on the program today. Why don't you tell us a bit about what exactly is meant by special needs or special care dentistry?
Thank you for that question. A lot of people do wonder what exactly is the specialty. So essentially, we have persons who may have a physical, medical, intellectual disability, or maybe compromised medically. So they may have some sort of health condition that can impact upon the way in which they are treated for all manners of health when it comes to their healthcare. And especially with dentistry, we may have to modify the way in which we approach our techniques towards keeping the health of the teeth and gums, etc. And of course, the teeth and the gums are in someone's body. So everything is linked. You know, I like to say the tooth bone is linked to the hip bone. So there is that link with the overall medical health of a person and their teeth. So in terms of special care or special needs dentistry, as it's called, it's basically a modification that would be required for some persons who have either a medical, physical, intellectual disability that precludes the routine treatment.
Right. So can you, from your experience, give me an example of some of the more challenging cases that you've seen working at the clinic and how you overcame those challenges for those clients?
So the thing is that not everyone with special needs requires special care, but there are those who, let's say they have a severe intellectual disability. And in addition to their oral health requiring a lot more, let's say they have a lot of cavities, so they would require a lot of fillings. So I've actually had a patient where they were on the autistic spectrum. So they have autism and they did not want you to physically touch them. So of course, if you think about your mouth, the only way to see what's happening is by touching the patient and examining. So for that patient, we actually had to sedate them. And this was in private practice. So we were able to sedate the patient and then get a proper assessment of everything that was required to be done. And, you know, going into it, we told the parent, look, let's try to do as much as we can, get everything done. So as you imagine, they hadn't been to a dentist in years because of, you know, various aspects. We're all sometimes afraid of dentists, you know, for these persons who are in and out of a medical hospital for their other, you know, medical issues. So we were able to sedate that patient and get everything they needed, cleanings, fillings, and a couple extractions. And then what I liked was that I was able to build the patient up to the point where they were allowing me later on to examine them and do basic treatment like a, you know, exam and a little cleaning. So the initial visit was one where we had to sedate, we couldn't get around it. But after that, we were able to, you know, use some behavioral management techniques and get the patient up to a level where they were allowing or tolerating me, I should say, you know, to examine and do other treatment. So that was one of the most difficult cases that I remember. But, you know, the thing is, I really like working with this population because with them, you can see, you know, exactly what is happening. You know, if they have changed their behavior, it's because they may have a toothache and they show you, you know, they say, okay, well, this is bothering me and this is why I'm behaving differently. So these patients would actually have a difference in their behaviors sometimes. And working with the parents and caregivers is very rewarding. And, just getting these patients to a level where we could do routine care and just preventive treatments is really, really, as I said, quite enjoyable and rewarding, not just for me, but for the parents and caregivers, because now they don't have to keep coming back to us for, extractions and cleanings and fillings, just some checkups and, minor things.
So, well, thank you very much for sharing that story. That's a good story because it raises a lot of key points about the care of persons with special needs. So you touched on the need for sedation, which I'd like to come back to in a little bit. But two other things that I thought were very, very important were, one, going slowly with the patient and building up that trust with the patient. That is definitely something that is required with persons with special needs. Sometimes you have to keep the messages short and simple, but you also have to repeat it a lot so that they will understand. And secondly, working with the family, because the family do need to be aware of what's going on. Sometimes they themselves are not fully educated as to what's going on. And if you work with them, they would then be able to help you to better interact with the patient and to keep them calm. So those were two very key points. Working in my clinical practice as well, I totally understand when you say that sometimes the more challenging patients are the ones that give you the greatest sense of fulfillment when you're able to help them. And looking at patients that I've seen, I know that, for instance, when I give a patient certain medications, they get dry mouth. Dry mouth then leads to a greater incidence of cavities as well as bad breath. So as clinicians, we need to be aware of the medications we're giving and the side effects and give appropriate information to the family members how to cope with it. Yes?
Absolutely. And one of the benefits of working in this discipline is that we call it a multidisciplinary team approach, but for the listeners, what we mean is just a bunch of us, from different aspects of the health. So we can have a dentist, we can have a medical doctor, an occupational therapist, a physiotherapist. We work in a team together. And it really is important that we know what each person is doing or what sort of medications the patients are on. So that's a very good point that you have raised, because sometimes parents or caregivers, it is very overwhelming. And to remember all of the medications that their loved one is on, it's a lot, right? I mean, sometimes we don't even remember what medications we are on, far less for our charge, a ward or a loved one. So what I usually advise is, if it is possible, to bring a list of the medication, a full list. And better yet, if you can have a letter of medical clearance from your routine medical doctor, that helps us a lot, because the medical doctor may say, okay, well, the patient has this condition, let's say a heart issue, and would need to be pre-medicated or put on antibiotics before medical or dental treatments. So that's something that's important for us to know as dentists. And exactly as you said, as a clinician, sometimes you may prescribe something that would cause oral side effects like dry mouth, or you can even have a metallic taste or bitterness. And of course, this makes the patient uncomfortable. And when they come to us, we would then say, okay, well, it's a specific medication. We'd have to liaise with the clinician to see if another medication can be used, or, if it's not possible to change that medication, then we would have to prescribe different things. So one thing we'd recommend is, of course, using fluoride mouth rinses. There are also mouth washes that help to make the mouth feel less dry, sort of like artificial saliva per se. So these are things that we can recommend as well. So I do love working in that team also with, my fellow healthcare professionals, because that way, again, the patients and their caregivers benefits holistically from our team approach.
Absolutely. The multidisciplinary team is very important, because we all know I know my specialty pretty well. You know your specialty extremely well, but I don't know your specialty. So we do need to liaise to discuss what is best for the patient. Now, before you go, you do the special needs clinic at the School of Dentistry at Eric Williams Medical Sciences Complex. Why don't you tell me a little bit about the work that you're...
So it is a teaching hospital. So we have students and interns who would have just graduated from our 5-year dental program. And they are all very eager and excited to work in this clinic. So we have a designated special needs dental clinic. It was originally commissioned in 2009, and it started off as an HIV/AIDS clinic, and then it eventually got established as a special needs dental clinic. Again, seeing the need for a specialized or designated area for persons with special healthcare needs. So we have that clinic, and it is on the ground floor. So it is, of course, accessible via wheelchair. And sometimes we have patients who are on the trolley, as we call it, stretcher from the main hospital. They come across to us for healthcare. So we have that clinic, and currently all treatment is offered at a subsidized cost at the University of the West Indies. And I know you and I have spoken about this, previously, that it is reduced cost, but ultimately we would like to see it being at no cost if possible. But what is done at the moment are routine dental care treatments, so cleanings, fillings, extractions, root canals, surgical extractions, and other minor oral surgery procedures. We work with the oral surgery department and all departments within our school. So even putting in false teeth, such as dentures, crowns, bridges, all of that is possible, again, depending on the patient and what is permitted with that patient based on their special healthcare needs. So those are the sort of services that are currently offered.
And that's so important. I think that sometimes we don't understand how important these things are, that persons who are struggling with so much, because persons with special needs, they have financial challenges, they have transport challenges. As you so rightly said, it's on the ground floor because of thinking about the mobility of the patient. The families are oftentimes stretched thin trying to, cover all the different bases. So sometimes something like dental care gets pushed to the background. And, if we could help to make it that these persons and their families can receive that help, then that's great. And to any corporate citizens that might be watching out there that might want to take part and assist in this venture to, make this even more affordable for the families of special needs persons, I'm sure they can reach out to you at the School of Dentistry to discuss how that might be done. And another thing that I know we discussed is that you're trying to bring on sedation services at the special needs clinic. Because as you said in the example with the patient with autism, they do need that sedation at times because they're unable to cooperate when they're fully awake because of their sensory needs and their hypersensitivity.
Yes, absolutely. So, my idea is really to take that private practice model and put it into the UWI Dental School, where it's accessed, again, either freely or at a reduced cost, that's for the sedation, and have it done safely in hospital where all of their treatment can be done. And the thing is, there is a cost benefit analysis to that, because if you think about having to go to the dentist repeatedly for multiple fillings, multiple cleanings, and multiple extractions, because we weren't able to get it all done in one visit, then there's a cost, exactly as you said. There's a transportation cost, there's the cost associated with the caregiver taking time off from work to attend, if the patient has babies, well, I wouldn't say babysitter for all of them, but let's say a caregiver at home as well, because we see children from, very young ages, from 3, so some would have babysitters. And then we also see adults. So I always say our clinic sees 0 to 100 in terms of the age group. But let's say you have someone coming to take care of this person, then you have to, arrange with that person, either they will attend with the clinic or take the day off, and all of that. It's a lot of logistics involved. So, which also is linked to cost. So not just the financial aspect of paying for the service, but all of the invisible costs that we don't see as clinicians, but the caregivers very much, are aware of all of these additional costs. So I think that, you can definitely see if you can get all of this done in one visit and then regular checkups every 6 months to a year, then that makes a lot more sense than having to bring a patient back 3-4 times in 1 month to do part of their mouth for cleaning, part for filling, based on what they can tolerate. And again, the sedation doesn't have to be every time, because we can work with the patient, work with behavior management techniques, and get them to a point where they may be able to tolerate routine dental care or some aspect of it, especially preventive aspects is easier than, which you can do without sedation compared to having to do, let's say, an extraction that you would definitely need a little bit more cooperation and do it under sedation. So I think that, the cost benefit analysis, when you look at it, it really does make sense to have the sedation and for the patients and parents to access it at a more reasonable cost compared to private practice. Because as you said, you're going to be spending money on medication, on, some of them on Pampers, and, all the different aspects of their care, getting a wheelchair, paying for 5 taxis to bring them, across. So it would help, and I think once we can offer that as an overall service, it would definitely benefit not just this population, but their caregivers as well, increase their quality of life.
So Dr. Balkaran, I want to thank you specifically, but also your staff at the Special Needs Clinic. Thank you for the great work you've done. Thank you for joining me today. And I hope we can speak again in the future and you can give us an update about what's going on at the clinic.
Certainly, and thank you so much for having me and for considering the link between special needs dentistry and the overall health.
Welcome back. As we close off this episode of The Present Mind, I would like to leave you with this thought. Rick Riordan said, "Fairness does not mean that everyone gets the same. Fairness means that everyone gets what they need." We all have different challenges and different needs, and we should all strive to move towards a more just and equitable society where everyone can access the resources that they need to grow and to succeed. Thank you for joining me today, and please join me next time on the next episode of The Present Mind here on MCTV.